A cervical collar is a medical device used to support a patient's neck, used for those who have had traumatic head or neck injuries, can be used to treat chronic medical conditions, and it's available in 4 size and inches and centimeter are mentioned here. And about the fitting of a cervical collar, first we need is the measurement of patient. Align the head to a neutral or eyes forward position unless contraindicated by your protocol. Second, we have to match the collar size to the patient. Choose the 4 adult position. Pedi-select, choose from children position, and note same basic method of adjustment for both collars. Third, adjust and lock the adjustable collar. Adjust the chin support to size. Select in the step 2. Lock both sides by pressing the 2 lock flaps. Fourth one, perform the collar. Fifth, apply the collar while manually maintaining neutral head position. Place the chin support well under the chin. If different size is needed, remove, resize, reapply the collar. For supine patient, slide the rear panel behind the neck before placing the chin support. Important note, do not adjust the select or pedi-select collar on patient. Pull the back of the collar snug while holding the front in the place, then fasten.
Vacuum splints operates by extracting air from the splint. Thousands of polystyrene balls inside the splint mold around the injured body part similar to a cast. Advantages are ability to provide support whilst relieving pressure at the injury site, ability to conform any shape, also used in X-ray.
Limb vacuum splint. Take appropriate flint size you want to use. This is to immobilize joint, communicate with the patient the procedure what you are about to do, and ask your assistant to raise the leg and place the splint underneath the patient's legs. Ask your assistant to put down too. Tie the strap securely. Do not place the strap if there is open fracture. Remove your turbo and extract a pump from the package. Put in the nozzle and sprint and make sure it is in the open position. Start to do a ride on the extraction complex salt and proceed to run the air and ask assistant if the splint is in fine cardinal. When there is enough extracted air, turn your dial to close position, move it back to your package, check circular and motor function again. Full body vacuum splint. The patient placed on the vacuum splint and have the strap tied around and make the same procedure as the limb vacuum splint and close down. It's for spine mobilization. Also hardens up about around the patient. Remove tube after closing and loosen the strap.
Disposable transport splints, which are used for immobilization of the cervical spine, shoulder, forearm and thigh. It gives medical aid for several patients. It was invented to be for an environmentally safe product and disposable too. It is made of the large pieces of the cardboard and the small pieces are not wasted. It has a long life. Log roll technique. It is usually used for the patients to make them get from the prone position to spine board. If a spine board is available, log roll the patient in the spine board. First medical personnel on the scene is the leader and they should issue all the commands. The leader should take control of the patient's head. The leader holds the head with both hands, stabilizing it, leaving no motion, and the leader positions the rescuers on one side of the injured person, one on chest, one on pelvis and one on legs. Place spine board on the other side of the injured person as close to him as possible or her possible. Direct rescuers to reach across the person and grab a hold of upper arm and shoulder, the pelvis and the leg. Roll injured person upon the leader's call. Roll in 3, 2, 1. Direct the one remaining rescuer to place the spine board to where the injured person is just lying underneath him, behind him. We lie the person down on leader's call. 1, 2, 3. and slide down on the count. The same 3, 2, 1 applies here as well, and slide up on the leader's call, and the same 3, 2, 1 applies here. This is how the leg roll technique is used over here to make the patient from the ground to the spine board. So there are also iron tug long spine board and scoop stretcher, combi carrier, and scoop XL, Miller body splint, and evacuate splint mattress. These can also be used in the transport stabilization of the trauma patient.